Hi, welcome to the mental health presentation. My name is Courtney Miller, and this project was also presented to you by Amy Winton, Courtney Disher, and Cheyenne Brown. For the table of contents, we will be talking about what is mental health, what is mental illness, how to be mentally well. We'll talk about a couple different topics, and then we're going to introduce some healthy lifestyles. I hope you guys enjoy. What is mental health? Mental health is the balance between social, physical, spiritual, and emotional aspects of life. Like, how do we feel about ourselves? How are we able to meet the demands of life? How do we feel about others? When we look at this, we can think of, how do we feel about others? Do we have a positive outlook on life and a general well-being? To meet the demands of life, are we able to cope with change? How do we feel about others? Are we able to interact with others, including having loving relationships? In order to maintain this, we need to have people in our lives that we trust. We need to take steps to resolve problems, and we need to pay attention to our lifestyles. Mental health theories. According to Shelley E. Taylor and Jonathan D. Brown in their article, Illusion and Well-Being, a social physiological perspective on mental health. For people to have normal mental health, it is essential that they carry overly exaggerated self-evaluations of themselves and unrealistic optimism towards a situation. These perceptions allow an individual to function productively in society, like being able to care for others, to engage in creative work, and the ability to be happy. The illusions allow humans to cope with negative feedback or other threatening situations. John R. McHugh, a doctor and also a professor at Johns Hopkins University, believes that mental health disorders are not diagnosed or treated properly in the health system. He argues that theories like labeling are being used for the convenience of health professionals. The labeling theory was first proposed by Howard Becker, and he argues deviance is not an act or behavior, but it is created by social groups in power. McHugh states, labeling and drugging is a convenient way of treating mental health disorders, and it is profitable for insurances and pharmaceutical companies. Doctors don't spend enough time with the patient to really diagnose the correct disorder. He goes on to explain that certain groups of experts with a bias propose the existence of conditions without anything more than a definition and a checklist of symptoms. What is mental illness? Mental illness is the behavioral or psychological issues that occurs in one and is thought to cause disability or distress. It is also a condition that disrupts a person's thinking, mood, and ability to relate to others and to function daily. Mental illness impacts the lives of many, but still the cause of mental disorders are unknown. When talking about mood disorders, you can also include many different mood disorders like depression, cognitive, which is thinking disorders like Alzheimer's, and behavioral, like eating disorders. To be mentally well, there are 7 categories or steps one must achieve. The first being subjective well-being, which is being satisfied with life. This would mean being happy or content with one's job, family, or anything else going on in one's life. The next category is positive feelings and beliefs. Beliefs or ideologies could include one's culture, values, customs, and social class. The 2 next categories would be personal and social relationships and engagement or participation in the community. This would include joining an organization like the American Cancer Society, which is to help fight back against cancer, or joining the Boys and Girls Club to keep children off the streets and to give them something to do once they're out of school. The last 2 categories or steps are occupation and sense of meaning. Occupation includes personal development, employment, and other activities. Personal development or growth and a sense of meaning is key to overall well-being. One has to be able to feel that they have gained wealth, success, and confidence in their life. But only knowing who you are and who you want to be is truly what completes these steps. Okay, in this presentation, we're going to start talking about mental health topics. We're going to be discussing anxiety, Alzheimer's and dementia, autism, eating disorders, and ADHD. How do you know if you have anxiety? Signs and symptoms can be both emotional and physical. Emotional signs may include a feeling of tension, irritability, or restlessness, and you may also find it hard to concentrate or even have negative feelings about yourself and life. The physical signs you may also notice may be heart pounding, sweating, shortness of breath, headaches, or insomnia. There are 5 types of anxiety disorders, which include generalized anxiety, obsessive-compulsive disorders, panic disorder, post-traumatic stress disorder, or social phobias. Generalized anxiety seems to be the most common anxiety disorder affecting adults, which has a long-lasting effect and is not focused on one situation. Statistics show that 28.8% of the adult population will develop an anxiety disorder, and women are 60% more likely to suffer from anxiety in their lifetime compared to men. Treatments for anxiety disorders vary depending upon the person and the severity. You can start by considering how well can you take care of yourself, or how well are you taking care of yourself. Assess how much time you leave for relaxation and for fun activities. Do you make time to exercise? Because that could help release endorphins. Taking away from your anxiety can sometimes even be as simple as asking for help when you need it rather than stressing yourself out. Also, if needed, there are both behavioral and medication therapies to help manage your anxiety. Lastly, before it is too late, we should all focus on prevention of anxiety. Exercise, eating a healthy and well-balanced diet, taking time to relax, and just do things that bring joy to your life. You can do this, and this will help ease the symptoms of anxiety. Now on to our next topic, which is dementia and Alzheimer's. For dementia, it's the loss of significant and intellectual abilities, such as memory. In order for a doctor to diagnose dementia, they will look at impairment of attention, orientation, memory, judgment, language, motor and spatial skills, and function. Most cases of dementia are non-reversible. Dementia is not a disease, it is a symptom of a disease. The most common cause of dementia is Alzheimer's, but there are 50 other diseases that have also been linked with dementia. 5 to 8% of people over the age of 65 will be diagnosed with dementia in their lifetime. Alzheimer's disease damages the brain and causes a steady loss in the ability to think, speak, and engage in daily activities. Alzheimer's disease is caused by a low level of chemical messengers like neurotransmitters in the brain, which help brain cells to work properly. Often people do not notice themselves that they have the disease, but friends and family close to them will. The most common symptom of Alzheimer's is dementia. This disease affects 5.3 million Americans, and over 50% of people around the age of 85 years old will have Alzheimer's. Currently, there is no cure for it, but it can only truly be diagnosed after death with an autopsy. For those of you that do not know what autism is, autism can be defined as a neurological condition with impairments in social interaction, communication with others, and behavioral development. The symptoms of autism can be seen as lack of expression because they simply cannot tell you or show you that they are happy or upset. Some lose the ability to speak along with social skills, and in stressful situations, most children and adults with autism will usually stim or do some sort of repetitive-like behavior. Some additional symptoms include withdrawing, self-abuse, and indifference to social overtures. Treatment of autism it doesn't really exist because you can't. Usually some doctors will prescribe some medication or behavioral therapies, but medicine can't cure everything, and especially with subdues like aggressive or violent behaviors. But with behavioral therapy, it can be effective, and in most cases it can be used to show such great improvements in communication skills. Some statistics with autism is that 1 in 110 children will be diagnosed with autism this year. Autism costs the nation $35.6 billion per year. Figures are expected to increase in the next decade, yet only $218 million will go towards autism research. And the last statistic is that boys are 4 times more likely than girls to have autism. Our next topic is eating disorders. There are many types of eating disorders, but the 3 most common are anorexia nervosa, bulimia nervosa, and binge eating disorder. Anorexia is a disorder in which people experience an intense fear of weight gain. In order to prevent the weight gain, they severely limit their calorie intake and become dangerously thin. Bulimia nervosa, more commonly known as bulimia, is an eating disorder in which people will eat a large amount of food in a short period of time and then purge themselves. In order to purge themselves, they may vomit, exercise too much, or use medicines such as laxatives. Binge eating disorders, also known as compulsive overeating, is eating a large amount of food in a short period of time. This habit can last for several months. Unlike anorexia or bulimia, a person is not trying to get rid of calories. Although it is common for them to limit how much food they eat between binges, over time many people who binge eat also gain weight.
In any other world.
Attention deficit hyperactive disorder is the leading mental disorder diagnosed in children, and it is more prevalent in males than in females. The cause of it is unclear, though some researchers do believe that it is genetics. Symptoms fall into 3 different categories: inattentiveness, hyperactive behavior, and impulsive behavior. Inattentiveness symptoms include challenges keeping attention during task or play. The child does not seem to listen when spoken to directly, fails to follow instructions, difficulty organizing tasks, and often loses toys and assignments. Hyperactive symptoms include constantly fidgeting, leaves seat when not permitted, and plays inappropriately. Impulsive behavior symptoms include the child acting before thinking and commits inappropriate acts when not allowed. Medication and behavioral therapy are the best treatments of ADHD. They work best when used together with psychostimulants that have a calming effect on the child. A doctor needs to constantly monitor the treatments and reassess if necessary. If ADHD isn't treated correctly, it could lead to trouble in school, problems with the law, and especially keeping a job, and substance abuse. Here are some statistics. Boys are 13.2% more likely than girls to have ever been diagnosed with ADHD. Another statistic is that approximately 9.5% or 5.4 million children around the ages of 4 to 17 years of age have been diagnosed with ADHD. The statistic was taken in 2007. Some facts. Children with ADHD compared to those children without were more likely to have minor injuries, hospital inpatient, hospital outpatient, or ER department admission. Another fact is that workers with ADHD were more likely to have at least 1 sick day in the past month compared to workers without.
Say goodbye to the world you thought you lived in. Take a bow.
Our last topic is talking about healthy lifestyles. Living a healthy lifestyle is an important part to having great mental health. Not smoking, limiting the use of alcohol, and decreasing overall stressors in your life are important steps to living healthy. Being active for at least 30 minutes per day and getting adequate sleep every night is also important. Finally, getting the proper nutrients in your diet and limiting sugar and sodium intake is the key to overall great mental health.